So, this first couple of lectures is really just the approach to the older pet from a neurological point of view. And really when you're presented with the older pet, the first aim really is probably to create a prioritized problem list, which can actually be, I think, very challenging sometimes within the constraints of a 10-minute consultation, especially as you may not be told the real problem straight away. So it might take some additional time to get to the bottom of the problem, because really the comorbidities can be confusing, and the neurological problems in the older animal are often never seen in isolation as being the only problem that the animal has. And I can give you a recent example of that. I was referred a 14-year-old Dachshund, and he'd had previous spinal surgery, the previous spinal surgery, it should be said that if an animal is paraplegic, it's pretty unlikely that they will have a completely normal gait, and as time goes on, neurons will drop off a little bit, and so sometimes their completely slightly ataxic gait can get a little bit worse, and that's probably what had happened with this dog. And certainly when I took a history from the client, bearing in mind that I have the luxury of a much, much longer consultation than you, the first words out the owner's mouth were, well, he's wobbly and keeps falling down. But actually, the more and more you got into the history, the more you found that the real problem that the client was coping with was the dog was PUPD. And that was not neurological in the strict sense, although actually he may have had diabetes insipidus. And so what the owner tends to do, I think, is sometimes put 2 and 2 together and make 5 for you in advance, which can be very, very confusing. And particularly, it's my dog is in pain because I'm presenting him because he's in pain, which is obviously something we home in on, but what they're describing as pain might not be the case. And it should be said that 14-year-old Dachshund was also presented in pain, but he didn't have pain. It was interpreted that his difficulty getting up, and actually it was volunteered that he may be drinking a lot because he was in pain, it was a kind of displacement activity. So establishing the facts may take some time. And the other thing is that really when you're looking at the older dog, you're looking at the neurological history as much as the examination. And one thing that we're going to talk about is really cognitive function scoring. And I've provided you with a sheet that looks like that, although I should say that I noticed a typo in it, and you will need to correct that, that the point system is actually starting from 0, not 1, for both of them. And we'll go into this a little bit more detail, but one thing I'd like to say is that prior to doing this, I wrote the lecture notes in about a month ago, and I've been using it in the clinic for every older dog I've got, just to see how user-friendly it is. And we use RoboVet, which is, there's no specialist software for referral practices, which can be a disadvantage. I'm not clever at IT and RoboVet, but I can have that as something that I can price. Not that I'm pricing it, but I can have it as like a new work entry and draw up that sheet and fill out that sheet whilst I'm talking to the client. And I find that really quite useful. And I would actually suggest that be something that is done in the annual health checks of these dogs as part of vaccination, because it will be useful to get some kind of baseline cognitive score. Or it's something that you could promote in your practice as a nurse clinic, for senior nurse clinic, to start doing that. So we're going to go